The News Hour Special Edition.
Welcome back. Niti Aayog member Dr. V.K. Paul has warned that the next 100 to 125 days are crucial in the battle against COVID-19. He said the Prime Minister has cautioned that everything must be done in order to stall the onset of the third wave, and he has said that this is possible only if people ensure strict COVID protocols are enforced. Meanwhile, the centre has cautioned people, but tourists continue to throng several spots across the nation, flouting COVID norms. Let's now go across to our guest joining us. With us, in fact, on the show today, we have Dr. N.K. Mehra, former Dean of AIIMS and Honorary Emeritus Scientist from ICMR, joining us live. With us also is Dr. Dipyaman Ganguly, immunologist and COVID-19 researcher at CSIR, Indian Institute of Chemical Biology, Kolkata. Thank you both, doctors, for joining us. Let me come to you first, Dr. Mehra. Dr. Mehra, it is, in some ways, it is mind-boggling that we have had, yes, people are fed up of sitting in their homes. They want to go from hotter areas to cooler climes. But what is mind-boggling is the fact that they've completely thrown caution to the winds when it comes to masks, when it comes to social distancing. And that really is a recipe for disaster, because we've seen the kind of impact that the third wave has had in cities such as Delhi, such as Mumbai, with beds running out, oxygen running out, the infrastructure running out, being woefully inadequate. But that does not seem to have had any impact on the minds of these citizens who are, violating all of these protocols.
Madhav, everybody is talking about the third wave, whether the third wave will come or not. And I think we must take lessons from the second wave. How did the second wave come? The second wave came because of the change in behavior of the virus and change in behavior of the people. The change in the behavior of the virus was we were ravaged by the alpha strain and then the delta strain. At the time in January, February, when UK was going through a very aggressive second wave, we were enjoying. We were thinking as if the virus has already gone away. And this is exactly the situation now, although the situation is a little different now. Therefore, everybody is saying that the third wave will come only if we do not stick to the virus-appropriate behavior. Because there are a few good points now. The good points are no new variants have come after the Delta strain, and no new ones which have the immune escape. Number two, we have already vaccinated about 40 crores of the individuals. And that's a very good number, actually. I think the rate with which we are going, we should be able to achieve the target of vaccinating about 45 to 50 crores by the end of July. And that's not a small number, actually. The third point is that the serosurveillance indicates that quite a few parts of India already has a lot of antibodies over there. So although we have not reached the herd immunity in total, but certain parts of India have already come to that stage. So I think these are all positive points. So there's a heterogeneity of the response that we are seeing across India. What we need at the moment, and that is a very, very important point, the change in the behavior of the people, actually. If the people can stick to the virus over the next few months.
Yeah. Right. Let me also bring in Dr. Ganguly. Dr. Ganguly, now one thing we all know, and this is something that several models have proved, is the fact that if you can delay the onset, you can also ensure that the peak is flattened, the curve is flattened that much more. The peak will not go as high as the kind of 4.5, 5 lakh kind of per day figure that we had seen in the second wave. And that is so important, because just the total number of cases, if it's reduced by a lakh or 2 lakhs or 3 lakhs or whatever may be the case, there's that many more lives that can be saved as well in proportion to that.
Exactly. Even if we think that third wave is inevitable, still, I think the flattening the curve will be very important. And the only thing that can flatten the curve is by maintaining physical distancing, so that transmission can be curbed. And so the population has a big amount of responsibility, masking up, maintaining physical distancing, not taking trips which are not really essential, and things like that are very important. And Professor Mehra was very nicely explaining we should learn from the second wave, how we reached the second wave. I think just after first wave, there was a lot of complacency in the society, and more so in the urban populations. I mean, I have been talking about this in different fora. So people who are well-to-do, they take trips, they put social media photographs, then there will be other people who will also try to follow up, because this our society is it follows a lot of role models, and if these role models are seen enjoying on sea beaches and things like that, rest of the population will also aspire. So I think the responsibility lies with all levels of the population, so that they maintain the restraint. The restraint they have been showing over 1.5 years, that has to be shown, because once someone breaks off restraint, it will percolate down to the whole society. And secondly, I think Professor Sumiran Panda pointed out in this morning, I think, that the size of the wave will be very different in different states, because sero coverage or sero prevalence against SARS-CoV-2 have been very different. The states which were affected less previously, they have to be more cautious, because definitely you can expect that sero prevalence is much less. Much less people are actually covered by antibodies. But we have to follow
Dr. Mehra, there is a section of researchers who believe that the third wave has already set in, because they say that the numbers that are showing very gradual but slow rise, the dip in cases has not been as much as a speed at which that was expected, is something that was referred to today by Dr. V.K. Paul as well. But do you agree with those who say that the signs are already there, that a third wave could have already begun?
Well, that's difficult to say. I know the way we had expected the dip after the second wave has not happened. At least in my state, West Bengal, I haven't seen that. It's still maintaining a baseline infection level, and there are ripples. There are daily ripples, not waves. You don't know whether this will continue for a long time, because when the COVID situations and all these apprehensions about bigger waves are also gone, these ripples will still remain there, because the disease will keep on transmitting as an endemic disease that we all of us know. But now, whether this ripple, the current ripple that we are actually seeing, whether that is a sign of a increasing curve, we are not very sure. But definitely there are some warning signs. I'll just point out one thing. There are some warning signs. For example, I have been seeing a lot of reports of flu-like symptoms with RT-PCR negative outcomes. And that's another thing we have to actually look at. I think the INSACOG should actually look into that, whether there are some variants which are missed by the RT-PCR. So things like that. So there are flu-like symptoms around.
I want to bring in Dr. Very important point there, but I want to quickly bring in Dr. Mehra on another very important point. Dr. Mehra, there are some states such as Kerala where the numbers are just not coming down. In fact, they've marginally gone up over the past few weeks. And Kerala is a state which has had an excellent track record as far as its public health infrastructure is concerned. It also has had a fairly among the higher numbers in terms of vaccines administered. But despite all of that, when it comes to the sheer numbers, they're just not going down. What explains this?
Well, that's a cause of worry, actually, because we are still seeing about 35 to 40,000 infections a day, although the number of deaths have gone down significantly. And also we see that certain parts of Europe, actually, there are already signs of the third wave over there. You can see in Spain, in the UK, and in Holland. Holland, of course, is actually going through a very, very sharp third wave. And India, the wave always comes about 2 to 3 months after. So that's a cause of worry for us. The worry is that we are still going through the tail of the second wave. The second wave is not coming down. We are still seeing good numbers of infections. Unless the total number of infections go down below 10,000 across India, then we can say that this second wave has already gone away. I don't know whether the third wave is set in India or not. I don't believe so, but we have to be very careful, and it is not going to be uniform. You're going to see a heterogeneous infections all across India. So I think we will have to take care from the state-specific point of view. Each of the states will have to think in terms of numbers they have, and then actually, think about their own ways of controlling it. But
all right, we'll have to leave it there for the moment. Dr. Mehra and Dr. Ganguly, thank you so much for joining us and sharing with us the scientific and medical perspective and why it's so important for all citizens to really mask up, ensure that you practice safe social distancing norms, and ensure that the third wave does not spread here in India. Thank you so much, doctors, for joining us.
The News Hour Special Edition.